Hello everyone, welcome back to the channel. I am Rajesh Arakh, and in today's detailed session, we will be discussing one of the most crucial life skills in emergency care, basic life support, commonly known as BLS. Whether you are a medical or nursing student, a healthcare worker, or a common citizen with no medical background, this video is for you. BLS is the foundational care that can mean difference between life and death during emergencies, such as cardiac arrest, respiratory failure, or choking. It is not advanced medicine, it is simple, timely action taken on clear guidelines, and anyone can learn it. Basic life support includes a series of steps designed to maintain the patient's circulation and breathing until the advanced medical help arrives. According to the American Heart Association 2020 guidelines, which remain the standard in 2025, the core components of BLS are early recognition of cardiac arrest, immediate activation of emergency response, effective chest compressions, rescue breathing when applicable, and use of an automated external defibrillator or AED. These steps, which HA called the chain of survival, the chain consists of 5 crucial skills. First, early recognition and calling for emergency help. Second, early CPR with emphasis on chest compressions. Third, rapid defibrillation using an AED. Fourth, effective advanced cardiac life support by trained professionals. And fifth, post-cardiac arrest care in a hospital setting. Let's now go into step by step on how to perform BLS, starting with an adult BLS. If you ever come across a person who has collapsed, the first step is to ensure scene safety. Make sure the environment is safe for both you and the victim. For instance, look for any hazards like fire, water, electricity, or traffic before approaching. Once the area is safe, approach the victim and check for responsiveness. Gently tap the person's shoulder and shout, "Are you okay?" If the person does not respond, you should immediately shout for help. If someone is nearby, ask them to call emergency medical services. In India, dial 112 and request them to bring an AED if available. However, if you are alone, call for help yourself by using speakerphone so you can continue assisting the person while calling for an emergency medical help. Next, check the person's breathing and pulse. Look for normal breathing, not gasping, and look for the pulse at the carotid artery in the neck. And remember, you should take no more than 10 seconds to assess this. If the person is not breathing normally and there is no detectable pulse, start CPR immediately. CPR begins with the chest compression, and this is the most critical part. Place the heel of the one hand on the center of the chest, on the lower half of the sternum, and place your other hand on the top of the first. Interlock your fingers, keep your elbows straight, and position your shoulder directly over your hands. Begin the compressions at the rate of 100 to 120 compressions per minute. The compressions depth should be at least 2 inches or 5 centimeters for an adult. And don't forget to allow the chest to fully recoil after each compressions and avoid interruptions as much as possible. After 30 compressions, give 2 rescue breaths. To do this, tilt the victim's head back and lift the chin to open the airway. Pinch the nose shut, make a seal over the mouth with yours and blow in for about 1 second. Watch for the chest to rise. This indicates effective ventilation. Give 2 such breaths and then immediately resume compressions. The ratio of the chest compressions is 30:2, and this cycle should be continued without interruption until the advanced medical emergency help arrives. If you are not trained to give rescue breath or you are unsure, you can perform hands-only CPR, which involves continuous chest compressions without any rescue breath. This is still highly effective and recommended for lay rescuers. If an automated external defibrillator arrives, switch it on immediately and follow the wise instructions. Expose the chest, apply AED pads as shown in the diagram, one on the upper right chest and the other on lower left side. Allow the AED to analyze the rhythm and make sure no one is touching the victim during analysis. If the AED advises a shock, ensure everyone is clear. Press the shock button and resume CPR immediately. If no shock is advised, continue the CPR, especially in the cases of ventricular fibrillation or pulseless ventricular tachycardia, which are the common causes of sudden cardiac death. Now let's briefly cover how the BLS works in infants or children. For children, which involves anyone from 1 year to the puberty, the process is largely similar to adults, but there are significant modifications. Compressions can be done with 1 or 2 hands depending on the chest size of the child, and the depth of the compression should be 2 inches or 5 centimeters. The compressions to breath remains 30:2 for a single rescuer, but changes to 15:2 if there are 2 trained rescuers. For infants under 1 year, use 2 fingers to perform chest compressions just below the nipple line. The depth should be about 1.5 inches or 4 centimeters. Again, the compressions remain 100 or 120 per minute. In 2 rescuer scenario for infants, a 2 thumbs encircling technique is preferred because it provides more consistent compressions. Remember to always check a brachial pulse in infants instead of carotid. A critical part in BLS is knowing when to stop CPR. CPR should be continued until the victim shows the signs of life, such as movement or normal breathing, or until the advanced medical help arrives, or you become physically exhausted or the scene becomes unsafe. It is essential to know the effectiveness of CPR depends on the quality of CPR being performed. Shallow compressions, ineffective rate, or frequent pauses can reduce the chance of survival. So it's better to be slow but correct than fast and ineffective. Now let's address a common question. Do you need to be a healthcare provider to perform CPR? The answer is no. The basic principle of life support should be learned by everyone. In fact, public training programs and hands-only CPR have saved countless lives worldwide. Schools, offices, shopping malls, and public places should have trained staff and AEDs readily available. Certification in BLS is available through AHA-approved courses and should be renewed every 2 years to ensure your knowledge and skills up to date. Basic life support is not just a clinical skill, it is a humanitarian act. It is the power to save lives in the most critical moments. Whether you're a doctor, a nurse, a student, or a bystander, your timely action can make the ultimate difference between life and death. I encourage all of you watching this to share the video, take a certified BLS course, and spread awareness in your community, because every second counts and every life matters. Thank you for watching. Stay informed, stay prepared, and stay human.